Hello and welcome to another episode of Daily Debrief, your primer on all the top news stories from around the world. I'm Siddhantani and joining me on the show is Prashant from People's Dispatch. Hi Prashant.
Hi.
Today we're talking about stories, or we're taking up stories from the United States, from Brazil, from Tunisia and from Denmark. We kick things off in the US where tens of thousands of women marched across cities over the weekend to protest increasing restrictions on abortion rights. As many as 660 demonstrations took place around the US on Saturday, including on the steps of the Supreme Court in Washington, D.C. The mass mobilizations are largely in response to a Texan law that bans abortions after 6 weeks of pregnancy, called the Heartbeat Law and signed into act by Governor Greg Abbott. Texas has banned abortion after cardiac activity is detected in the embryo, which happens usually around 6 weeks. According to reproductive health experts, this is before most women even know they are pregnant, and earlier than as many as 85 to 90% of all abortions. What's worst is that a lot of this law relies on ordinary citizens to enforce the ban, which makes no exceptions of rape or incest and rewards people who are sort of taking this vigilante action with at least 10,000 US dollars if they successfully sue anyone who helped provide an illegal abortion. No matter where you live, no matter where you are, this moment is dark, said Alexis McGill Johnson, president of Planned Parenthood. She was addressing the crowd for the Rally for Abortion Justice in Washington, D.C. Prashant, several traumatic results of all of this conversation that's happening in the US, and we saw several of the protesters wearing 1973 on t-shirts, referencing the 1973 Roe versus Wade judgment that gave access to a generation or generations of American women to abortion. What is the context that has led us up to this point?
Right, Siddhant, quite a few points actually, and this, of course, is a very vital struggle for women and people in America, across the world as well, because this is, and I think it's something that in People's Dispatch we've written about extensively, that this is a struggle that's going on in various parts of the world. We'll come to that later. In the United States, of course, 1973, the Roe versus Wade judgment and the precedents that followed after that ensured access, like you said. And this is what right-wing groups in the United States are trying to overturn. So there's a very concerted campaign, a very powerful campaign directed at the freedom of choice of women, directed at their bodily autonomy, and using fundamentalist rhetoric and basically a lot of fundamentalist ideas. So basically what we have here is that there is an attempt at the legal level, there is an attempt at the societal level to push back the advances that have been made on this issue over the decades. And this is especially important now because the Supreme Court of the United States is actually going to hear a case on a similar law. So you talked about the Texas law, which is incredibly restrictive, which actually massively criminalizes abortion. And like you said, it makes people into vigilantes. You become a vigilante in terms of you rat on your neighbor, or you report your friend sometimes, or you report somebody you may not even know very well. So basically, this law exists by turning people against each other, which is one of the worst ways in which it functions. The other aspect, of course, is that a very similar law in the state of Mississippi is about to be heard before the Supreme Court. And if the Supreme Court gives a particular judgment, what it means is that then states can impose restrictions as they like it. So some states may, some states may not. There are estimates which say that 26 states might impose restrictions almost immediately.
Wow.
So the possibility is that, and the important thing to note, of course, is that the United States Supreme Court is right now dominated by conservatives. The majority is around 6-3. So there is a good chance that the decision might be in favor of this perspective, which takes away restrictions from the states on imposing such laws. So what we're looking to probably is actually a very prolonged period of struggle, because, like I said, there are women's organizations across the United States have declared that, progressive organizations, they have declared that they will not stand by this, that they will take to the streets, they will protest. There are some moves in Congress, in the United States legislature, to sort of codify this as abortion as a right. So that's going on in one direction. Whether it will happen or not, it needs to be seen. But the most important thing is really, I think, the people on the streets, the people who are building solidarities, the people who are organizing campaigns around this issue right now. And for them, this is a very key moment because, like I said, what they're faced with is not just one law. It's an entire network of organizations across states, backed by big corporates, backed by extreme right-wing interests, backed by even some religious interests, which are really sort of out to, push these restrictive laws and enshrine them in the constitution. So a big challenge there for women, progressive people, radical people across the United States. And I think that the coming months will actually see an intensification of these struggles. So that's where we are at right now. And like I said, it's a very important Supreme Court session that has started. The case might probably come up in a couple of months, and the decision could have an impact on the lives of millions of people. The important thing to note here, of course, is that it's always the women, poor, who suffer, because there have been, for instance, estimates which say that women who are slightly better off might be able to go to other states, but those from working class backgrounds, those from racially disadvantaged backgrounds, they are often those who actually suffer the most. And this, if the Supreme Court, for instance, passes the kind of judgment it's expected to pass across the country, they might be affected even more.
So anti-poor, pro-vigilante, at a time when actually pro-choice and pro-abortion movements are gaining steam, not just in the US but around the world, and we're seeing some positive movement in several countries in Central and Latin America on that front. What are the implications likely to be for these countries, for legislation there, as well as for, like you briefly mentioned, other states in the US?
Right. So it's just a few days ago that September 28th was the International Day for Safe Abortion. The women of the International People's Assembly actually published a very important article. I think everyone should read it. It talks about the global scenario on this issue right now. And what we need to really note is that whatever advances have been made here is a result of prolonged struggles, is a result of popular agitation, especially in Latin America and many parts of Asia, for that matter, Africa, even in Europe. Sometimes people think that the global north is very progressive on these lines, but actually there are much more subtle restrictions, restrictions which are not openly talked about. They may not be laws per se, but there are structural restrictions and structural obstacles to women when they want to access this procedure. So this article actually lists out a lot of these instances and also binds together, I think, the struggles on this issue, which is a very important thing, because acknowledging it as a global struggle, as a struggle of people, of progressive people across the world, is a very important step. And I think that in Latin America, like you said, there have been advances. There have been advances in Mexico. There have been advances in Argentina. There have been advances in Ireland, in Europe, many other countries as well. And I think that for a large section of the popular movements across the world, this has become an issue which they're taking up with a great deal of intensity and passion. And we are expecting to see probably positive outcomes across the world as well.
Right. So we're sticking with healthcare in a sense when we move on to our next story, which is from Brazil. The private healthcare provider Prevent Senior used patients as test subjects for COVID-19 treatment and then hid the real number of deaths due to the virus. On September 30th, members of the Brazilian youth movement Levante Popular da Juventude held a protest outside the headquarters of Prevent Senior in Sao Paulo. The movement alleges that this healthcare network, in pursuit of greater profit, subjected patients to all kinds of unethical medical practices, which in turn caused avoidable deaths. Many of these practices of the group were reportedly in line with the beliefs of President Jair Bolsonaro, whose unscientific views on the pandemic have been widely criticized around the world. Prashant, what are the charges being leveled specifically, and this is a government investigation going on? What are the outcomes so far?
Parliamentary investigation, actually. Right. So there's a parliamentary commission of inquiry that's actually looking into this issue. And the fact is basically that the charges against this healthcare network are very dire because they span a variety of, all aspects of healthcare, so to speak. So on the one hand, there's a question of treatment of COVID-19. So the allegations are that instead of properly admitting them and treating them, they were given COVID-19 kits in which experimental treatment was used. Now, this experimental treatment was used in the sense that doctors were told to use them, and if they objected, they were threatened with reprisals or even punishment or firing of that sort.
Right.
So that's a huge, a huge crime to do, for lack of a better word, at a time like this was during last year, the peak of the pandemic. When the pandemic had started, people were scared, people were hoping for the best treatment, and here you have a hospital chain which reportedly did this. Now, the hospital chain, of course, has denied it, but this is information that comes out of a network of doctors from the hospital who are whistleblowers. The doctors are anonymous. The doctor's lawyer has leveled these allegations. So important to note that. So that's one aspect of it. The second aspect of it, of course, was the fact that there are even charges that, some staff were oriented that death is also a form of discharge. So, there was a reduction or restriction in the flow of, what you would call oxygen supplies to the ICU. in terms of ventilators. So because apparently this was also a way of discharge, so to speak. And then, of course, the fact is that there is an allegation that numbers were fudged in terms of COVID-19 death counts. So all of this actually, throws Prevent Senior's credibility at a, it's a huge blow to it. Now, while the company has denied it and said that, they will wait for the investigation, they will, say all these charges are false, they will prove that nothing was true. But the fact that the detail with which some of these allegations have come out really throws a question. And the fact is also that at some level, this organization is also believed to be closed to the Bolsonaro family. Jair Bolsonaro's son, Flavio Bolsonaro, in fact, endorsed the treatment plan that this network of hospitals had. So that's really the question in terms of, Brazil has had one of the most horrific COVID-19 experiences.
Over 600,000 deaths.
Exactly. And this comes out of the fact that, there's been a complete chaos in the handling of the pandemic, and also willful and malicious, treatment of the pandemic from the highest levels, from the president onwards. So it's not surprising that, even the lower levels, even at the public level, at the private level, there is this kind of an attitude, because you had a leadership which from the very beginning approached this pandemic in the most unscientific way, almost showed defiance, actually behaved in such a way that, they were like, it was like saying that we don't give anything about the pandemic, we don't care about it, come what may, we'll face it. And that was the kind of attitude that from the highest levels of the Brazilian government they showed. So this had an impact in terms of the death toll, this had an impact in terms of the structural, organization of Brazilian healthcare itself.
Right.
And most of all, I think this had an impact on, say, the scientific perspective with which people should have viewed this pandemic, because when you have your leaders doing this, what do people tend to do? So I think that's really one of the most unfortunate stretches, or one of the most unfortunate cases of how a country dealt with a major pandemic in the past 1 year.
Yeah, it is, and a sharp focus, I think, on how also private healthcare is dealing with some of these global health emergencies. And in the context of this wider epidemic that's going on around the world of unscientific approaches to what should be scientific problems, we spoke earlier to NewsClick's editor-in-chief Prameer Purkayastha about what he had to say on the matter.
COVID-19 should have been an example where the global leadership as well as country leaderships could have shown the way how to treat a public health problem and how to treat it scientifically. Both have not occurred. We can see different countries behaving in what would be called a completely anti-scientific way, rather than talk about science being center stage in a public health disaster or pandemic of this nature. One was, of course, the question of what are the medicines. We can understand initial hesitation, initial lack of knowledge, promoting certain kinds of medicines, because at that point of time we didn't really have anything. Therefore, hydroxychloroquine, therefore ivermectin could be understood. But once we had looked at this medicine seriously, we had double-blind trials, we had really a lot of experience on looking at different kinds of medications. The fact that they've still continued, and they've continued not only in the United States, backed by Trump, Bolsonaro in Brazil, they've even continued, for example, in India, backed by the ICMR, which had till recently these medicines as possible medicines to be used against COVID-19. So this is one element of the anti-science attitude, but also the anti-vaccine campaign. And as you know, a global anti-vaccine campaign exists. It has been backed by some important figures, some of them claiming to be scientists as well, might have been scientists once upon a time, no longer. And you can see all kinds of fiction being peddled as so-called science, and you have a handful of number of people, 12 to 20, who apparently originate 80% of this anti-vaccine nonsense. But we shouldn't also forget there are other kinds of anti-science campaigns being launched. For example, the talk about the lab leak being an equal possibility with this pandemic originating from nature as a SARS-CoV-2 virus jumped species. Now, increasingly more and more evidence is coming out of a nature to human leap. In fact, we are a part of nature. And instead of that, the so-called pushing of the lab leak hypothesis is really a part of the larger campaigns that the United States has launched against China. So I think when we look at science, we have to understand that fighting for science, fighting for public health systems is something which doesn't come natural to the political systems we have, and therefore the need for public science, for popular people science campaigns therefore becomes necessary.
To Tunisia next, where the Speaker of the Parliament, Rashid Ghannouchi, urged lawmakers to resume work in defiance of President Kais Said's suspension of the assembly. It marks a new escalation in the country's political crisis. The dispute is over the legitimacy of Said's seizure of control of most legislative and executive powers way back in July, in what his opponents have referred to as nothing short of a coup. Prashant, just paint a picture for us of the political scenario in Tunisia to begin with.
Right, Siddharth, like you said, President Kais Saied basically right now in control pretty much of the entire country. And he in July, like you said, suspended parliament, dismissed the prime minister and took over power. And at that time, there was a mixed response, of course. But recently, just a few days ago, he basically said that he could rule by decree and he did not have to abide by all the provisions of the constitution. Then he appointed a prime minister, someone who's a technocrat, has no political experience so far. So basically what Kais Saied has done is really done what people are calling it a soft coup for a reason, because in a series of strokes, so to speak, he has completely taken over the political system of the country. And this is important to note because Tunisia was one of the countries where the Arab Spring took place in 2010 and 11. And Tunisia was perhaps the only country which actually managed to have a political system that lasted from that time until now. So it was a mess, there's no doubt about it, because there were multiple prime ministers, there was political chaos, there was a lot of disagreement. But nonetheless, it was a functioning political system. And you can say the political system of many countries in the world is a mess.
Sure. Yeah.
So there were various rounds of protests. For example, earlier this year, there was a massive protest by the youth on the issue of unemployment. Even over the past few years, there have been many, many such rounds of protests. But despite all this, there was a functioning democracy, so to speak. But now with President Kais Saied's latest moves, there's a lot of lack of clarity about what's going to happen. And what he's done basically also is that there are rumors that he plans to rewrite the constitution, and this has led to the old parliament, which is suspended, is concerned about what is going to happen. So Kais Saied right now in a position where he's there's a massive economic crisis going on. The public debt is around 88% of the GDP. Unemployment is around quite high, I think, in the 15 or 16%. So there's this huge state of crisis. The COVID-19 pandemic was handled very, very badly. And all this were reasons which Saied sort of said, the reasons he cited for doing this takeover.
Right.
But now really the question is that what is he planning to do? And in the last 2-3 months, we've not heard anything on those lines. So people are increasingly beginning to get skeptical about his moves, whether it's just an old-fashioned power grab under the guise of, saving the country, as so many leaders are prone to say.
So who is fundamentally opposing Kais Saied in this case, and what is the opposition demanding?
Right. So good question, because the Tunisian society there seems to be a lot of strands going on right now. In fact, over the weekend, we saw quite a few protests supporting him. But if you look at the past many weekends, there have been huge protests opposed to his move. And I think some of the divisions were reflected in the fact that initially there were some sections which were supporting him in July. That's after he suspended parliament and dismissed the prime minister. But with his latest announcement in September of ruling by decree, many of these sections have actually started opposing him.
Right.
A very good example is the UGTT, which is Tunisia's largest labor union. They were initially fairly on his side, and now they have shifted their position entirely. There are sections of the left, especially led by the Workers' Party, which have been very consistent from the very beginning in calling this a presidential coup, and opposing it. The Islamist Ennahda Party, which is actually the largest in parliament, there also seems to be a bit of a schism there, because initially they were very much against it. Then there was some amount of moderation. So there's a little bit of lack of clarity. Some leaders resigned from the Ennahda, stating that they were not happy with the lack of opposition, or the strong opposition to the president's moves. But nonetheless, broadly, they too seem to be fairly opposed to it. So I think various strands of Tunisia's political system are opposed to it. Some sections, for lack of, over time, we might see more of these sections actually switching against the president.
Right.
So that's really
maybe very quickly, just to cover, where is Kais Saied currently getting the bulk of his power from?
Right now, I don't think there's really a question of legitimacy per se, because there's no real way of measuring it. Right. Because it's not that it's not that he's elected via parliament. The presidential election was separate, and so he's running on that mandate.
Right.
So, and he basically probably has the support of some of the key institutions in the country as well. In fact, the question of whether the army is backing him is very much
a big question
there, right? So right now, I don't think, like I said, there is a real challenge to him that way in terms of there being a massive mobilization yet. It might happen in the coming weeks and months if he's not able to show any drastic change in terms of policies, and so far he is not. So I think one of the key issues is the fact that Tunisia is among one of those many countries which are really stuck in terms of a policy paralysis.
Right.
You've got a horribly declining economic situation.
Yeah.
At the same time, you don't have the tools to get out of it. Your only tool is to take a loan from the IMF or the World Bank, which comes with more conditions. So what you see is unemployment keeps increasing, inflation often happens, there is no infrastructure, there are no jobs, there is very little public spending. All this together creates a perfect little mess for many countries, not just Tunisia. And I suspect Tunisia is also in that basket, and Kais Saied right now has power, but whether he'll be actually able to make any kind of drastic change, considering the limitations he or any other ruler for that matter has, is a big question.
Thanks for that, Prashant. Before we go, we're addressing or at least getting into the age-old question of whether life imitates art or whether it's the other way around. The artist Jens Hanning is a Danish artist, I'm assuming. He received the equivalent of over $80,000 to create a work of art, work of modern art. In return, the Kunsten Museum of Modern Art in Aalborg received 2 blank canvases titled "Take the Money and Run." Hanning calls the work a commentary on poor wages, of course, and says that whatever else it may or may not be, it's definitely not theft. The museum may not have bought his explanation, Prashant, but they have displayed the works nonetheless. Where do you fit in the conversation on modern art to begin with?
On modern art, I claim no expertise at all, to be very honest. Although it's an interesting commentary coming exactly on the day when the Pandora Papers have been released. So the artist's work is called, like I said, "Take the Money and Run." And that, in some senses, is exactly a reflection of what is happening in every part of the world. You have huge billionaires, who are stashing money in tax havens. Nobody knows about this unless somebody leaks information. And like I said, the Panama Papers came out in 2016. The Pandora Papers have come out today, and they reveal, these massive tax havens that are there across the world. And I think this is a question that, in some senses, it's an interesting question to anybody who watches it. Apparently, the exhibit is quite popular, the 2 blank canvases, and the title especially, because it sort of throws a question at all of our societies, all of our countries, that what exactly, who's taking the money and running?
What is going on?
Exactly. And, unless we ask those questions really of our political leaders, our social leaders,
our economic leaders, our business leaders.
Exactly. As the old, the old statement went, always follow the money. So that's, I think, a good lesson for all of us today.
Yeah. Interestingly, the museum has titled the exhibit "Work It Out," and it's meant to be an exploration of our relationship or people's relationship with the work that they do. We'll be back continuing our work on Daily Debrief tomorrow, where we will, of course, be talking about what Prashant just mentioned, the Pandora Papers and more. So until then, we leave it to you to work out which side of the fence you're on. Thank you for watching. We'll be back same place, same time tomorrow. Goodbye.